Hi, my name is Gia Smith. I will be doing an abdominal assessment. First thing I'm going to do is when I walk into the room, I'm going to wash my hands. I'm going to introduce myself. Hi, my name is Gia. Do you consent for me to do the video? Yes. So she did consent for us to do the video. Her name is Janet. First when we do abdominal assessment, the first thing we're going to do is we're going to look at the abdomen and see the shape of the abdomen to see if and do an inspection to see if it's symmetrical, to see if the abdomen is distended, to see if the patient has any other issues. I'm going to ask her, when was your last period?
I don't remember.
Do you have any abdominal pain right now?
No.
When was the last time you urinated?
About an hour ago.
Do you need to void before I do the assessment?
No, nothing.
Okay, thank you. So the first thing I'm going to do is an inspection. I'm going to make sure, look at her skin, see if there's any scars, any marks, to see if she has any masses, any areas that are bulging or protruding, and she has a nice flat abdomen with none of those issues at this time. So my next thing for abdominal would be an inspection. I did an inspection. The next thing would be an auscultation, because I want to auscultate before I palpate or percuss, because I want to make sure that I don't disrupt her sounds before I do that. So I'm going to put my stethoscope and use my the bell of the stethoscope, and I'm going to check all 4 quadrants for bowel sounds. And I'm going to listen to each quadrant until I hear bowel sounds. Okay, 1, 2, 3, 4. So I heard bowel sounds in all 4 quadrants. If I didn't, I would listen to for a full 5 minutes. I'm listening to see if the bowel sounds are normal, hyper, or hypoactive. Then I'm going to look and look for her aortic artery to make sure, to see if I hear any sounds. Then I'm going to move over to her renal arteries, and I can check both sides. And I'm going to look at her umbilicus to make sure there's no redness, no swelling, or anything in her umbilicus. And then I will listen to the iliac arteries. I'll do that a little deep because they're in the back, and I'm looking to hear if I hear any swishing sounds. Okay, that's it with my auscultation. Then I'm going to do my palpation. First, I'm going to do light palpation with my fingers, and I'm going to go around her stomach clockwise, her abdomen clockwise, looking for any masses, any hardness, asking her, do you feel any pain when I'm doing this?
No.
Okay, no pain. Okay, so she feels no pain when I'm doing this. So then I'm going to go into deep palpation. And I can do that either with one hand if I feel okay with that, or I can go 2 hands to see if I feel anything. Any pain when I'm doing this?
No.
Okay, so she's feeling no pain. I go all the way around her abdomen. No issues. Prior to this, when I come into the room, I would ask her about any surgeries, any procedures. If she had a Foley, I would check the Foley. If she had any ostomies, I would check the ostomies, make sure they're all draining properly. If they have any redness or anything, any swelling at the ostomy site. And if she had a PEG, I would check the PEG site to make sure there's no issues with her PEG. And I also would check sounds through the PEG tube. Thank you, and this is Gia Smith, and here is my abdominal assessment.